So what we're going to do is, the tumor is in the GE junction, GEJ, okay? So it involves some of the esophagus and then it extends onto the stomach a little bit.
Right.
Okay? I think the total length they said was about 5 centimeters.
That's it.
Okay?
Feels like a huge thing in there to
But
me.
so the esophagus is a food pipe.
Yeah.
And so it doesn't take much to close off that food pipe and make it hard for you to swallow food.
Right.
When we look at cancer of the esophagus, it's not so much the size of the tumor.
Right.
It's how deep it goes into the lining. So if I were to cut the esophagus right here
Right.
and give you what it looks like from the inside, it's kind of like this,
Mm-hmm.
Here's the inside of it right here.
Right.
And these tumors sort of grow inward and they grow outward.
Right.
Okay, so it gets bigger and bigger. So your tumor is probably blocking off most of the esophagus and it's growing out like this, okay?
Okay.
So it's not so much the length from a head to a toe direction that's
Right.
important, it's the depth. Because the deeper it goes into the lining of the esophagus, the more likelihood it has to jump to lymph nodes.
That's what he said it had done.
Yeah,
And he said
Okay.
it's spread to surrounding tissues or
the
something.
surrounding lymph nodes.
Okay.
Okay, so first thing we do when we have a cancer of the esophagus is we stage it.
Right.
Okay, so what's the stage? Based on the size of this tumor, we think it's what we call a T3N2 or stage 3 tumor, 3B
Okay.
to be exact.
All right.
Okay?
Okay.
Most patients will have stage 3 tumor. Most patients will come in with some lymph nodes already metastasized.
Right. Okay.
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 Right. So what's the treatment of this? There's 2 types of treatment. One is chemo and radiation
Okay.
only.
Right.
The difference, and then one is chemo, radiation, and then surgery.
Okay.
Okay? It used to be surgery, but lately that's kind of fallen off the recommendation.
Right.
The difference between these two is the patient's physical status.
Okay.
Meaning if you are 80 years old in a wheelchair, this is probably your best option
Right.
because the surgery is a big operation.
Right.
And the difference between these two is the dose of the radiation. This one, they give them a maximum radiation.
Right.
This one, they stop around 5,000, which is just the dose of the radiation.
Okay.
And then we wait, usually 6 to 8 weeks,
Right.
and then we do the surgery.
Okay.
And then after that, we see how the patient is doing,
Right.
and then go from there.
Okay.
Usually you're done after this. No
Right.
more treatment.
Okay. So, I mean, as far as the surgery goes, and you've looked at it, how much do you think of my esophagus and stomach would have to come
Okay.
out?
So I won't be able to tell you that without looking at it myself, which I will do. So
Okay.
what we're going to do is once you finish the chemo radiation,
All right.
that's going to be the next 6 weeks or so.
Okay.
Okay. Then you're going to come and see me.
Okay.
Okay. See me. I'll just put me.
Okay.
I'm going to do an EGD at that point myself.
Okay. By the
Okay?
way, this is Dr. Deb. He's part of my oncology team.
And I'm going to repeat a PET scan
Okay.
just to make sure that it hasn't gone anywhere else.
Okay.
I'm going to do the EGD, and then we're going to do the surgery.
Okay.
At that time, I'll know how much of your stomach to take out, and so okay.
Okay.
And then, so the surgery, and I'll like to rather go through the surgery in more detail later because
Okay.
you'll forget a lot of that.
Yeah. Yeah.
And but just for your video, we take about 2/3 of the esophagus and about 1/3 of the stomach.
Okay. All right. What kind of recovery
And-
are you looking at on that? I mean,
So it's about 2 weeks in the hospital.
and then do I have to stay on a feeding tube or anything
You
like
will have
that?
a feeding tube for a little bit of time.
Okay.
Once you've healed up and you're eating well, and you come in here and say, "I'm eating okay."
Mm-hmm.
Then we take the feeding tube out here in the office.
Okay.
I put the feeding tube in at the time of the surgery. Now, this is one of those forks in the road.
Right.
If you're losing weight and you're not eating, then we probably should put a feeding tube in now,
Now? Holy crap.
just to be preemptively strike.
Okay.
But if you tell me I can eat, because I'd rather not do that.
Yeah.
Because an operation, even a
Yeah.
feeding tube, sometimes can go
Trigger the.
delay your treatment.
Right. Okay.
And nothing is small.
Right.
So if you tell me I can drink Boost, Ensure, I can mash potato myself to,
Yeah.
with lots of gravy, I'm good.
Okay.
I can maintain my weight. Then we'll forego the feeding tube
Okay.
and you start treatment. But we can always do the feeding tube during treatment, but it's a lot more rope-a-dope.
Okay.
Tap dancing, I should
Right.
say.
Okay.
It's harder to do it then. But we could do it. I've done it.
Okay.
They might have to stop your treatment for a week and then restart it.
Okay.
But you don't like to give these cancers that kind of a chance because
Right.
it's like the petri dish, bacteria growing in a petri dish. You expose the bacteria to penicillin,
Sure,
you
yeah.
kill off 90% of them, 99% of them. But
That
one
yeah.
bacteria will survive.
And it's immune, huh?
It's got resistance, and then it'll grow.
Right.
And then the next time you throw the penicillin at it, they all laugh at it.
Right. Yeah.
Same thing with cancers.
Yeah.
It's once you start knocking it down, it's going to die off, but
Yeah.
it won't die off completely.
Right.
Because you could say, well, why do you do the surgery if we're doing chemoradiation?
Right.
That's why, because most of the time there's some that are sitting in there that aren't dead,
Okay.
and those cancer cells will start to grow and they'll be resistant to treatment.
Okay.
But generally what we do is we take the esophagus and part of the stomach,
Right.
and I'll go through this in more detail, and then I pull the stomach up.
Yeah.
So it kind of looks like this,
Yeah.
okay?
Okay.
Here's your abdominal cavity, this is the chest, heart sits here, and this is the other side, okay?
Okay.
So this is the right side, and then this is the abdomen.
Okay.
Okay, and then the hookup will be here. So the operations are done through the belly. It's
Right.
about 8 hours of surgery. On a scale of 1 to 10,
Yeah.
this is a 12.
Holy crap! See there?
So
Yeah.
this, but this is something I do once or twice a week.
Wow.
I do more than anybody in the state.
Okay.
And we try to do these without opening up all the way. So I
Right.
try to do with the little holes in the camera.
Right.
Maybe have to make one little incision or something.
Okay.
But it's about 5 hours of work in the belly. Put the feeding tube in, and we roll you on your side. We go into the right side of your chest, and then with the little holes and whatever, it's another 4 or 5 hours of work. And then you go to the intensive care unit where you'll be for at least a week
Holy shit!
with the tube down your nose, for which you'll hate my guts. Okay, and feeding tube, but the nice thing about the feeding tube is I can give you nutrition while you're sitting there healing.
Unconscious, huh?
Yeah. You may be on the breathing machine for a little bit. I don't
Yeah.
think so.
Right.
And then once you're, around a week or so, and we'll go over this again.
Okay.
You drink some barium.
Yeah.
Because, I'm not the best plumber in the world. Nobody is.
Right.
This is not going to be 100% watertight.
Right.
And it always leaks a little bit. And that leak is saliva.
Yeah.
Can make you very sick.
Yeah.
So I leave lots of drains in there.
Yeah.
So if it does leak, which is rare,
Right.
it'll come out of your body. But I have you drink the barium, make sure there's no leaks. Then we
Okay.
celebrate. Take the tube out of your nose, start giving you liquids to drink, and then by the time you're going home, you'll probably be on liquids.
Right.
And then within a few weeks, you can advance your diet. I can tell you that patients, after barring any major complications, getting home, healing, within about 2 or 3 months, it's going to take you a good 2 to 3 months before you get your sea legs back. Okay.
Okay. All right.
But once you're healed up, you'll be eating pretty normally, and you can get back to work and your career and your life.
Okay. All right. Thank you very much, Dr. Deb. That was really informative. I appreciate it.
Sure.
Bye.